the guy on the right, the same day, has a bunch of hair. And once the blood, you wash it out and those crusts go away in a couple of weeks, the hair stays for about 4 weeks. After 4 weeks, all of that hair is gone. Do small areas, do the most minimum amounts of transplant, because that hair will regrow if you have the right program.
Dr. Ray Nettles is redefining hair and hormone health with data-driven precision, transforming patients through custom biochemical insights. Get ready for a conversation about real results and lasting health.
All right, welcome back to the Dr. Ray Show. Dr. Ray, there you are.
Hello,
Welcome
Tracy. How are you?
I'm good. How are you doing? It's been a little while.
Today better than yesterday, and I hear that tomorrow is better than today, so we're sticking around. God orders the steps, we just show up.
Very good, very good. All right, today we want to talk about transplants again. We had a lot of really good feedback on the previous episodes we did on transplants. And today I wanted to cover the question that I get a lot from people who basically people want to have a quick fix to their hair loss. They want their hair back right away.
Okay, so transplants, we're going to talk, we covered it before. And what's interesting, the last couples of cases have been some transplant cases that have come in. So they are listening to the podcast and they're making the right decisions. So transplant, and this one, people are calling you and they're saying, well, hold on, why do I want to grow my hair? I want a quick fix. All right, good. So let's talk about that.
They think that growing takes too long, so they want it fast.
Growing hair, you're right. Growing hair takes too long. I agree. It does take a time to grow hair. It takes time to lose it sometimes too. The time usually is about half the time to grow it back than it takes to shrink the hair. But the quick fix, here's the issue, Tracy. Quick is true. The transplant surgery is instant hair. Instant hair. You're going to walk in with no hair, and they're going to put living hair follicles onto your scalp. There's nothing that can replace that feeling ever. So we will never be able to be quicker than a hair transplant. But the problem is the next part of that word, fix. So you said they want a quick and fix, and that's where the problem comes in, because a hair transplant is quick. There is nothing quicker than permanent instant hair, but it is not a fix. In fact, it is the quickest way to get a permanent never fix. With a hair transplant, you will never be able to fix your hair. Let me say that again. With hair transplants alone, you will never fix your hair loss issue. It is quick, but not a fix. So regrowing your hair before or after a hair transplant is the best way. You can slowly recover as much hair as you can regrow while the permanent instant hair is already there. And I think we touched on this the last time. The issue is the way the hairs grow out of your scalp versus the way we transplant hairs into the scalp. The roots are buried under the scalp, and the hair, the small tiny hairs, come out of the scalp, and they come out in many different directions. And then use your brain. We're going to then take a hair follicle by the roots and then put in a hole big enough for about 100 hairs, but one follicle. Hairs are small, but the follicle's large. But you can't make just a small incision to put a hair in. You have to put the roots in. And there is the problem. So the size of the hole, even though it's small and microscopic, it is 5 times the size of follicles. So you're going to get about 1 to 5, about 20% coverage. And for some people, Tracy, 20% coverage is enough. For anyone under 60 years old, 20% would never be enough. Now, that sounded very drastic, that 20% coverage. Let me share with you a couple of cases where people have gone that I'll share with you a couple of photos, and I'll tell you what it looks like. One patient had 3 transplants, 2,000 grafts each. That's 6,000 grafts, okay? And once again, let's look at our head. Okay, 100,000 hairs on our head. We lose half of our dome, 50,000. Okay, you got 50,000 to replace 50,000, a home of 50,000. You can only take a couple of strips, or you can only take out those individual single follicular units, but you can't take more than 20% or you're going to look pretty silly. So now you've got 10,000 grafts covering 50,000 grafts, and you've lost 20% in the back. This becomes a nightmare. So the answer is no to the hair transplant. The answer is yes to regrowing your hair. And then sometimes hair grows fast, and sometimes it does grow slow. But you'll know long term what the permanent look would look like. In the case of a couple of years of regrowing your hair, if there's one or two patches you want to fill in, we can do that easily. We know exactly how many grafts we have to use, and we know how many grafts that are needed in that area. But if you've got a large area trying to cover with all hair, it's never going to happen. When I first started the hair restoration practice, I went and learned from Dr. Elliott the best way to do the best transplants for all the Beverly Hills patients that he was doing. And then I started doing some transplants for the clinics that were not offering the hair regrowth. And then I said, let me start my hair regrowth clinic. And I said, listen, if the hair does not regrow, I'll then do the transplant. I'm very trained on it. I know how to do it, and I'll do a great job. After 3 years of regrowing hair, not once, not even once did I have to give them a credit for it not to work well enough. So in 3 years, I couldn't do a hair transplant today. Now it's been 20 years. Thank God in heaven that I don't have to learn how to do the hair transplant anymore. But it's not necessary. That's the takeaway point.
Yeah.
I today with my hands cannot do the transplant. Now they've got robots doing them because people, the doctors, have realized it didn't work. Never was anybody satisfied. Never were they happy. Never did it look great. You see a lot of fake photos online, but no, you can never transplant a case to look as good as my hair. Never. And all those other companies out there, all the doctors saying, come do a transplant, look at their hair. It does not look like mine. Go look at Keeps and Hims and Lockbox and all the founders. Their hair does not look as good as mine. So it's not because of me, it's because of our program. It's because of blood work. It's because of the ingredients. It's because of our doctor looking over the cases. It's because of the pattern recognition. Each molecule, each ingredient treats a specific cause of hair loss. Sometimes the hair is not growing, you need a growth stimulator. Sometimes the hair is thinning, you need something to reduce the thinning. Sometimes the immune system is causing changes in the stages of the phases of hair loss. Then you have to work on the immune system. But you don't use all molecules at all times. In certain seasons, you may use several ingredients. In certain seasons, you'll use several other ingredients. But everything's based on our every 3 to 6 months reviewing the patterns, listening to the history, looking at the photos, looking at blood work once a year, cobbling together a program that works consistently for the rest of your life. That's the offer. So the quick is true, but the fix is not true. That's the takeaway.
All right. Can we go into more detail about what happens in
Let's
a quick?
look at a couple of those photos I told you. Sorry,
Yeah,
I meant I was going to show you some. Let me share you
yeah.
some, and we can have a conversation about these. So I think we touched on this one the last time we talked about transplants. Yeah, this is the issue. The guy on the left doesn't have hair in the front. And over on the right, the guy on the right, the same day has a bunch of hair. Okay. And once the blood, you wash it out and those crusts go away in a couple of weeks, the hair stays for about 4 weeks. And then guess what happens?
It falls out.
After 4 weeks, all of that hair is gone. All of it.
Yeah.
All of it. It then regrows in about 6 weeks. So the quick to their fix, they get a quick, then they get a loss, then they get the quick again, then they get the hair to regrow again. But even then, you get the shedding from some of the hair that was not transplanted. So a lot of times they'll say that area looks better, but now the other areas look worse. Yes, that should have been told to you because that is 100% going to happen. You're damaging the circulating blood supply to all the other surrounding follicles. So they will shock out. And then a lot of times we used to tell the patient, we pray that it shock comes back. And it does sometimes, and sometimes it does not. Okay. But the key
Yeah.
is to avoid that. Okay. Avoid shocking the hair and only transplanting the small area that you need. A lot of times they go in and they pull out 2,000 hairs. They say, put them all over the place. You now damaged the entire scalp. You damaged the entire scalp. If you can just do a transplant in one or two small areas, there's less damage to the rest of the scalp. Hopefully that's a takeaway for some of the patients. Do small areas, do the most minimum amounts of transplants, because that hair will regrow if you have the right program. Okay. So that was one of the photos, Tracy. And I think there's one more I'll share with us here. Let me see if I can find it. This patient, this
is
that
that 20% density, right?
Yeah, so this is after 3 transplants, right? 6,000 grafts, 12,000 each, $20,000. But it's not the money, and it's not that sticking all the holes in the head and the cutting and all that stuff. But look at that hair, and you can through it on the sides and the back and the front and no way. And he's still
And it
losing hair.
doesn't stop it. Yeah, it doesn't stop it getting worse, right?
So no. And then, and this is a good case. This is a good case. What you're seeing on the screen is a good case. And you say, that's not a good case. That's a bad case. Let me show you a bad case. Let me show you a bad case, a case that came into my office. You guys think this is a bad case, and I'm telling you this is a good case, because this is a bad case. You see this? Their hair starts to recede backwards, and you get temples like a real man, right? A young person does that. They get scared. So first thing they do, they start putting in hairs all in the temples and in the front hairline. Absolutely the wrong thing to do, right? Because there is a natural hairline for a man. And it's rounded and it slightly goes up, but it does not straight go across like this hair transplant. And a lot of times when you're doing the hair transplant, the doctor does what the patient wants. And the patient wants a straight all the way around hairline. Absolutely not. I used to draw with a permanent marker what I was going to do for them. I didn't care what they wanted. That had nothing to do with it. It had to look natural, and then it had to be within the area where hair grows. You see how obvious this photo is, because the hair is way outside of that natural hairline.
Also, it's receding back behind it, right? So it's continuing to recede behind the transplant.
Yeah. So quick, yes, he's got a gob of hair in the wrong place. And what's my recommendation for this patient after spending all that money on transplanting hairs?
What?
Hair removal.
Oh,
hair removal. I said to him, listen, you made the mistake. Don't continue to live with the mistake. Remove those hairs and you'll have a nice hairline. Okay, nice natural hairline.
Yeah.
Okay, Tracy.
That makes
hopefully that's enough. If that's not enough, they want to do a transplant. have them show up to the consult, because in the consult, we're going to review your photos before we look at blood work. You guys could come in, send your photos. I could save you a lot of time, effort, money, and energy and pain. Hopefully they'll come in with their photos, Tracy, and even before we get the blood work, we can just review the photos for them.
Exactly. Perfect. Thank you, doctor. I appreciate your time as always. We look forward to speaking again next week, and I will have a new topic for us to talk about. You got it. Very good. That, in recap, hair transplants are a quick but not a fix. But not a fix. Hi, if you like what you see in our episodes and you would like to see more, please make sure to like and subscribe. The link is below here. And in that way, we will notify you as soon as the next episode comes out. And next week is going to be a great one.